Right, a very good morning. You're watching Western Television. This is the Kokoliriko show that comes every Monday to Friday. My name is Federick Dramadri. I'm here with some guests, but before I introduce them, there are so many issues that we will be unveiling for you here, and looking at some of the highlights of the issues that happened over the weekend and over the week. Before we move to that, remember today we are starting this show a bit late because of some of the technical issues that we could not really manage to cope up with to make sure that we started at 7. Ideally, we're supposed to start by 7 and end by 8:50. So this is where we are, but sometimes things can go, sometimes delays can come, but also let's bear some of those situations. But you are most welcome that we are still here with you. We don't want to leave a minute to go without just really greeting you, but also telling you what is happening within the region. Last week we had so many issues, and also over the weekend a lot of issues happened. I remember the sentencing of the member of parliament for Arua district, that is for a county, that is Federick, has been sentenced to 6 months to Arua prisons, okay, Arua government prisons, and this is after the loan that he borrowed from a financial institution was not paid for quite 1 full year, and this was 58 million Ugandan shillings, and this member of parliament has been really dodging the warrants that were given to him and summons that were given to him. But remember, in July, the speaker also sounded a warning about these money-lending institutions that are overcharging people, but also extorting a lot of money from people. But that does not stop someone from borrowing from these money lenders. It depends on your agreement. But the most important thing is at least having that respect for yourself. When you have that little money, you should be able to share and really commit to pay some of these monies. The terms, you must first consent to whether whatever you're borrowing is going to really have a leverage to what problem you have. Okay, those are some of the things. I remember there were issues to do with immunization. Western region, if you look at the 2023 Uganda Demographic Health Survey report that was released in September, you realize that Western region performed actually poorly in terms of mobilization of children to come for vaccinations, and that is where we are really coming from. And also where we want to bring our guests is to talk about some of these things now that we have October, which is the month of vaccinations, okay, and so many monies have been disbursed to local governments to help in mobilization, to help in also the health workers to do the work, and that is where we want to go. Some of these monies have been injected by health ministry, a lot of good sums. Recently, Arua Council approved 29 million Ugandan shillings that will be going direct to LCs, VSTs, and also the health workers to help in doing this. And that supplementary was approved with other entities also benefiting. Talking about upgrading of Kokoliriko Health Center 3 to 4, which also got a slot in the first phase, 500 million Ugandan shillings. But also there's another program called financing activities of forcibly displaced persons, and this is only for Arua City and the Gulu that they are going to benefit from this, and that money is coming from UNCDF, and it's worth 3 billion, and that is where the issues of the self-settled refugees, the asylum seekers, immigrants, and so on will be sorted, and part of this money will be there to build a complex multi-purpose hall, which will be at the current Arua public library, and issues are coming up about that, but we may not talk much about them right now. But let's introduce our guests and talk about the immunization campaigns that are going on, what is going on, and really what they have really packed for us. First of all, let me start from the left-hand side. I have Luciana, who is now the in charge of Kokoliriko Health Center 3 that we are yet to upgrade. Anena, you're most welcome.
Thank you very much, our moderator. Good morning to all our listeners out there. My name is Lucia Nena, as he has already stated, and I work for Arua City in Origo Health Center 3, as well as the HIV focal person for IVU division. But for today, we are here in for Integrated Child Health Days program.
Okay.
Thank you.
Yeah. Actually, I just forgot about that focal person thing, and I remember using you so many times in that capacity. But all in all, you have already guided about it. But we have viewers, we don't have listeners. This is a TV, and I just want to correct you on that. Alfred, you're most welcome.
Thank you, presenter. Call me Mina Alfred. I am Assistant Inspector of Schools attached to Central Division. But why we are here is to talk about the Integrated Health Child Day. I am here basically to handle the issues of our department, which is education.
Yes.
Thank
okay,
you so
we will go into that. Let's start from the health worker. Lucy, what are those things that you have already prepared, and what is it that has already come to the city from the ministry, so that we are able to know what is happening, what is already there, what is not there, in terms of our preparedness to go on with the vaccination campaigns?
Yeah, thank you very much. Arua City is actually prepared for this vaccination program. This is what we call Integrated Child Health Day program, meaning that it is a multi-purpose activities. It's going to be actually carrying out a lot of activities besides vaccination. That's why we call it integrated. And this vaccination program normally takes place within the period of April and October. It is twice in a year. That's why we are here in this October for this program. It is actually taking place the whole of this month. It started by the 1st of October this month, and it will continue up to the end of the month. But why we are here is for the purpose of mobilization for the accelerated days, which begins on the 18th of this month, and it will go for 5 days, from 18th to 22nd. And in the first day, the first 3 days, we are going to be in schools. That's why we actually have the representative from the education department to speak to their people, the leaders of school, to mobilize the children for this program. So we are going to have this program for the first 3 days in all the schools. Then the last 2 days, that will be a Saturday and a Sunday, we shall have it in the community, where we are going to maybe stage at trading centers where there are previous vaccination posts or outreach posts, and also we shall be in the places of worship, like in the churches or on a Sunday. Meanwhile, during the first 3 days, also we shall have the places of worship, which is mosque, on Fridays. So this is how the program is going to run.
Okay.
Yeah.
So what do we have, and what don't we have?
Actually, right now we are in preparation to receive the commodities that are required. As health centers, we've not yet received. We still have some days, but at city level, that is at the DVS, that is the district vaccine store. You'll find that some of these items have already reached, but they are waiting to be dispatched at the health facilities. Yeah.
Okay, when we talk about immunization, we have so many killer diseases. More have been really put in front. Maybe let's talk about these diseases that we're going to really impact on, to really trying to eliminate among the children and also the people who are going to be targeted under this campaign. What are those diseases that we're talking about, but also who are those who are supposed to benefit under this program?
Yeah, thank you very much.
Yes, continue.
Thank you very much. The vaccine, let me first talk about the vaccine briefly. When we talk about vaccine, in our own terms, it is an antigen, something which is introduced in the body to stimulate the body so that it can be able to produce immunity against a specific disease that enters the body or infection. Meanwhile, to the local people, we can just say it is something which is used to stimulate immunity against infections. So during this program, we are going to be doing routine immunization, which I've already talked about. We shall also have COVID-19 vaccination. COVID is still in existence, though many people have already forgotten. I actually want to say that about 2 months ago, 2 months ago, we still had a case. We got somebody with the COVID. So everyone should still be vigilant. COVID is still there. Then during this period, we are also going to have deworming. We shall be deworming children. Actually, we shall start from the age of 6 months and we'll go up to 14 years age. Then we shall be doing growth monitoring also for our children, because it is important to know how our children are growing. Are they growing well? If they are not, we normally do nutrition counseling for the mothers so that they prevent those. Then growth retardation. Then we shall also be doing screening for malnutrition. Amongst other diseases, we shall have malaria screen, cervical cancer, shall have HIV and hepatitis B. Screened. At this period, during this period, we shall also be doing vitamin supplementation. We shall be doing ANC and postnatal care. ANC is the antenatal care. That is care that we normally give to pregnant mothers from the time of conception or from the time they conceive or become pregnant. We take care of them from that period up to the time they deliver. That is what we call antenatal care. We're checking how is the mother doing, how is the baby in the womb doing, and also be able to identify maybe some problems that could be anticipated during delivery, and the mother is advised accordingly. Then in postnatal care, we also be postnatal care, that is care given to the mothers that have just delivered from the time they deliver up to a period of about 60 weeks. We check the mothers at birth, how they are, is there any bleeding. Then also the babies, we check how is the cord, is there any bleeding, is there any infection with the babies. We keep monitoring them in the first 6 hours after birth, then weeks after delivery, we monitor them like that.
Okay, let's move away from health perspective. Talk about education. Remember, there were issues to do with the consent of these children by parents and so on, especially when they want to do massive testing and vaccination. Remember, during COVID, there were a lot of issues to do with the consent and so on, and the law was very clear that at some point, if you want to maybe vaccinate or give administer any drug, the parents should be able to consent, because of some of the children who died during vaccination, not in Western region, but in some parts of this country. Those were stories that were really running throughout. But I don't know what is currently taking place. Let's move to education department. What is it that you have deployed on ground to ensure that the parents are in the know of these processes, but also the school administrators are able to give you the children? I remember during COVID, there were some schools that turned their way health workers because they felt like their children should not be vaccinated or administer those vaccines. Yes, you can pick it from there.
Yeah, thank you, moderator. I am Mina Alfred, Assistant Inspector of Schools, Arua City. Why I am here today is to ensure that our institutions, these learning institutions, are all aware about the program. As a department, we are aware about the program because as a sister department, we always do work together with the health department. That's why our education department is aware about this program on ground by Ministry of Health.
Yes.
Education department is part and parcel of this program because this program targets school-going age children, and as a department, we have planned to reach all the heads of these learning institutions. We are going to have letters circulated to all the schools to see that this program is embraced. Truly, this same program is targeting not only government-aided schools, but it also targets private schools, knowing very well that being private doesn't mean that the learners are private. No. So those are our citizens, and they all have the services. I now encourage all the head teachers to embrace this so that our learners in future don't develop such kind of health complications. This same program is not only targeting school-going children, but we have children who dropped out of school. They are at home. So I am also encouraging the parents to take lead in the mobilization so that the same children also access the services. It might not be the responsibility of parents alone, but the entire community, including the LCs. They are so key in mobilization if we are to achieve the target to immunize all these children during the program. Thank you.
Okay, we are left with the approximately 4 days to reach 18th that the health workers have said that they are supposed to start rolling out this. When do you intend to reach these schools? But also making them prepare themselves is also one thing that is very important. If you are going to write letters, you expect feedback at some point. So what grace period are you giving for yourselves to reach these schools?
Mr. Moderator, reaching these schools is not a challenge for us as a department. First of all, we intend to write to all the schools, and we have a platform, WhatsApp, where we can easily reach to the heads of the institutions. What we do is we write, we publish on our platform for the head teachers, meaning that to reach them is not a big thing now. Just a matter of opening, buying a bundle, and I am quite sure many of our heads of institutions, 99% of them have smartphones, and they are aware of our department always reaching them on the platform. So they are always informed through that. Not only that, but the letters we write to them we always ensure that the letters reach all the schools so that our learners access the service as planned. Thank you.
Okay, the integrated child health days are very important in terms of preventing those diseases that we may really see in children after a long period of time. Sometimes they may not really attack the children at the earliest stages, but this will be after a few years when you have at least some time. Talk about lameness, talk about so many other things that always come. But let's move back to Anena. What are some of the interventions you have deployed as health facilities or in charges or maybe the health officers in these various facilities, but also looking at the communities at large? What are some of those things that you have already deployed on ground to ensure that this mobilization is strengthened, but also ensuring that people are able to get or collect them, gather themselves for this vaccination or these interventions? I know it may not all going to be vaccination, but there are going to be also oral medicines that will be administered to people. Talk about some of these children who are going to get deworming tablets and many other things. Yes.
Yeah, thank you very much, moderator. During this period, we have interventions that we have put in place to help us reach the community. Arua City has prepared actually mobilization van that is going to move around to mobilize the community. And we've also just had a radio talk show, which was on Saturday. We were on radio actually passing information to the community. At the same time, on ground, a lot of stakeholders are actually going to be part of this program. They are going to be helping us in mobilization. We have the environmental health assistants who are always on ground in the community, and they will be doing mobilization. We have the village health teams. They will also be doing mobilization in the community. We have the ward agents who are our leaders in the community, the LC1s. All these people are going to be doing mobilization, as well as the religious leaders. Actually, while we were on radio, we actually passed information, and we are still again passing the same information that people should actually now be on toes. Everyone, it is everyone's responsibility to ensure that the messages reach down to the grassroots and everyone is aware of this vaccination program, because when your child is vaccinated and for your neighbor is not vaccinated, it may not be of help, because there is what we call herd immunity. If majority of people are vaccinated or majority of children are vaccinated, you realize that it will protect the minority children who are not vaccinated. But if only a few are vaccinated, that means when there is an outbreak, even the ones who had been vaccinated may not escape. So that's why we are really calling upon everyone. It is all of us. We are supposed to be part of the mobilization to ensure that this program is a success.
Okay, somebody is asking that why is it that some of these integrated health days are supposed to be a must to every children? Maybe, do you have answers to this question?
Yeah, integrated child health day surely is supposed to be a must for all the children. Earlier on, you had asked me to explain the vaccines we are going to use, and you did not give me the full time. So okay, I think I can be able to explain to this person the reasons, the benefit, the importance. Yeah, actually, vaccination is a must for all the children because of these reasons. One, we have a vaccine that is called BCG, and this BCG is normally given to all the children at birth. When they are born like this, they are given this vaccine, and the purpose is to prevent them from having TB. You can imagine when a child gets TB at that early age, it might not be easy for your child to survive. So you can see how important it is for this child to get the TB vaccination to avoid tuberculosis. This is a very serious disease, we all know, and it is dangerous. Then we also have OPV, which is a vaccine given to children at also birth. These ones they drop in their mouth, and actually it is important because it protects children against polio itself. Polio is a disease that makes a child to become paralyzed. All of a sudden your child was born well, crawling well, maybe walking, all of a sudden the child begins to fail to walk. Or maybe the hand cannot pick anything, yet the child was normally doing these things. So it protects the children against paralysis of such kind. So you can see how important it is for all the children to get the vaccines. Then also, we give children during this period the vaccine called DPT. It is a combination actually. It has 5 vaccines in it, which it is called pentavalent because it has 5 vaccines in it. And these 5 vaccines are also meant to actually prevent 5 different diseases. And these diseases are whooping cough, hepatitis B, Haemophilus, influenza, rotavirus, polio, and pneumonia. So this one is given to babies at 6 weeks of age. All the babies are supposed to get it. And they get first dose, they get second dose, and others they get even up to 3rd dosages. I want to talk about rota vaccine. Rota vaccine is the next one that I'm going to talk about. Rota vaccine is given to children to prevent diarrheal diseases. I think you can bear witness with me. For those of you who have frequently gone to hospitals, I want to give an example of Arua Regional Referral Hospital. In those days, before the rota vaccine had come in, you realize that if you enter in the pediatric ward or the children's ward, as we call it in our in the lay language, children's ward, if you enter that ward, would welcome you with a very bad smell in the past, because all the children almost were having diarrheal diseases due to rotavirus. But right now, if you enter in Arua Regional Referral Hospital Children's Ward, you enjoy because those smells have ceased to be there due to the rota vaccine, which is given to children, and it prevents the rotavirus infection. This one is given to children at 10 weeks of age. Then most of them are repeated up at 14 weeks of age. Then lastly, I also want to talk about the measles rubella vaccine. This one is normally given to children at the age of 9 months. The first doses, measles, mumps, and rubella. It is a 3 vaccine combination. It protects children against the 3 diseases as well, measles, rubella, and the mumps. And also yellow fever, the vaccine is there. It is also given at 9 months. Then we have HPV, which is human papillomavirus vaccine. This is given to girls at the age of 10 years, and it is given up to like 9 years. This is meant to protect the girl child from cervical cancer. They are given early at this age, but in most cases it shows up at around the age of reproductive age, around 25. If they had developed it, then it can show up. And when they screen, it can be got. It's very dangerous. It can destroy the whole uterus of a girl child. And that means the girl may not produce if she had not produced again. So it is very important. Then tetanus toxoid vaccine is also given to prevent tetanus at the age of 15 years to 49 years of age, reproductive age. Then we have the second doses of measles and rubella at 18 months, that is at 1.5 years. Then lastly, we have vitamin A, which we are also going to be giving to children from 6 months to 5 years. This prevents diarrhea also, measles, eye diseases, and malnutrition. Then lastly, deworming. We shall be deworming all children from 2 years to 5 years as well. Thank you.
I thought you were going to say vitamin A is for food, yeah? Because that people used to say you buy it for you to consume more food. But anyway, as we go for a break, I want to read this one of education just here immediately. There's a head teacher who is asking that what is the roadmap? That because there are moments, sometimes you people move there in schools abruptly, it finds when children are not prepared and so on. What is the roadmap? As we come back from the break, we should be able to answer that question from there. And also from the health perspective, somebody is also asking that why is it that many times when these programs come, they move like a rush on a rush? Why can't we give ample time for people to get the niche of what is there in this program, but also make sure that they give themselves time to come for these vaccinations, just like any other campaign that always comes at some time. It takes like 2 months or 3 months like that. And these are two questions that will be coming back afterwards. And let's take a break. When we come back, we'll be still continuing with the discussions to do with integrated child health days. And this is in Uganda. It is always between April and October. Those 2 months are actually dedicated for these kind of campaigns. And it is very, very important that every person should be able to consider taking his or her child to get some of these things, based on the importance that have been attached to them, and also the vaccines and the drugs that have been mentioned here. You have been able to pick some 2 or 3 things from them. I hope you'll be able to understand and also disseminate this to one of your neighbors who has not been able to watch this. But you can follow us on YouTube. That is the Kokoliriko Live on West Vision. You should be able to also share your comments there. But also if you are on our WhatsApp platform, you can share, drop your comments there. We'll be able to read them. And they also ask the experts here instantly. Let's take a break.
West Nile TV, lighting up the region. We are the passion you've been waiting for! It's Yunus Junior Santamo! It's our league, our football, our boys, our style. Start Times UPL new season starts 15th September. Go for it! What a finish from Fukume! The Ugandan flair, Brazilian samba, Portuguese magic, the night football craze. More TV games live on Senyuka Prime and Fufa TV only on Star Times. The Star Times UPL, our league, go for it. West Nile TV, lighting up the region.
Okay, welcome back from that commercial break. You are still watching West Nile TV. That is the Kokoliriko show that it comes every Monday up to Friday. But here we are discussing about the integrated health Child Health Days, and this is one remarkable event that happens in order to prevent children from contracting some of these preventable diseases that we could prevent by using these vaccines at early ages, when those times of giving them to children come. That is where you'll be able to avoid them, including polio, tetanus, and so many of these, including the cancer, but also giving leverage for the mothers to go and check their systems, whether they are doing well or not, and so on. But I don't know why they have not also added the one of men. The cancer in men is not is not a priority. But anyway, we will see how to break into that. If we are talking about equality, we should be able to look both genders. So that is to Health Ministry now, not really the guests I have here. But inside I have the in-charge of Orivo Health Center 3, but also is the focal person for HIV division, but also CW as a representative of the City Health Department. We are discussing about the Integrated Child Health Days, but also I have the Inspector of Schools. Remember, schools are partnered in this because most of the children are now in school. And we believe that the school-going age is the best that really suits this program. But most of the target will be in the schools, but also we'll have these others that are out, as explained by some of these guests. But also I also have Alfred, who comes from the Inspectorate of Schools in Arua City. And picking it from there, there was one head teacher who asked a question about a roadmap. How is it that you are going to roll this into schools? How are you going to do this? Is it that you are just going there randomly because you said by 18th you are going to start this? And you said also you're going to write to these schools using your different platforms, but also official letters will be also issued to these schools. How are you going to ensure that the schools are in the know and they will gather in one place for easy administration of these vaccines and also some of those drugs to the children? Yeah, you can pick it from there.
Yeah, thank you. The focal point person did say the accelerated program is going to start from 18th. According to the roadmap, the health team is going to begin the program in all the schools from 18th to 20th of this same month, meaning that the head teachers, you'll be informed that from 18th to 20th, the set health team are going to reach all the schools. So I request you people to accord the necessary support to these people so that our learners all access the services. Thank you.
The health workers in administering these kind of things is very, very paramount, and some of the attitudes of the school administrators have not been good in terms of these kind of programs or programs that are being rolled. Talk about vaccination. The recent report of health workers being turned away in Arua City was evidenced in Arua Central Division. I will not mention the school now. I hope they have reformed, and for future reoccurrence or not to repeat that mistake again, what is it that you have put on in place to ensure that these health workers, when they reach these schools, they are safe and they are able to really reach these children?
Well, our school now so compliant to government programs, whether it be private or government. That information that some schools stopped this kind of activities done in schools. I think there was a small information gap which they did not receive earlier from our department as education. You know, when somebody comes and wants to have activities done in your school without a prior information, that one brings in other issues. So why I am here, I am to clear to all the land institutions that these integrated child health days, the education department is fully aware. That's why we are rolling to you, the institutions, in order to see that our learners are all with the services. Thank you.
Okay, before we went for the break, there were questions that were targeting the health workers. Maybe, Lucy, if you can pick it from where the questions were asked. I hope you still have the question. Yes, okay, you can start from there.
Yeah, thank you very much. The question which was asked actually was about the vaccination being always in a rush, especially the integrated child health day. This vaccination program, I would say, is really not in a rush. Maybe there is information gap, because as I said earlier on, this program has already started, but only that it is not massive in all other places. Right now it is going on at all the facilities, all health facilities within Arua City. That is what we call static program. It is unfortunate that the city cannot afford to run it as a massive program from day one in October up to the end of the month. That's why the accelerated one is always only for 5 days, because it requires a lot of support. There is need for transport, there is need for a lot of movement, maybe SDAs for the health workers and people who participate. So it becomes hard to make it massive for the whole month. Otherwise, anyone can be able to access these services in any nearby health facility. All the wards in Arua City has got a health facility, either private or public. Even some wards are blessed to have like 3, for example, Pajulu ward has 3 health facilities, 1 public and 2 private facilities, that is Ediofe and St. Assumpta. But all the health facilities are providing these services. Even other big private facilities in the city, they are going to be actually doing this program. So that is it. The
Okay.
5 days is short, but it is right now going on.
Okay, so there's this question from Annie Godfrey about the safety of these vaccines, or the things that are going to move into the communities or during this campaign. But, some of these have been reported entering into private facilities. How are you going to safeguard these equipments that are to be given to the health workers to move during this campaign? Talk about the vaccines, talk about some of the drugs, the tablets, they talked about the vitamin A's and so on, that are sometimes described as precious and very hot cake for some of the people to also really do some business with. Are you going to ensure that these things are really utilized for the intended purpose?
Yeah, thank you very much. I appreciate the person who has asked that question, because that is a clear indication that we are all concerned. I want to inform the public that the vaccine or the vaccine carriers are actually safe, because these activities are going to be done during broad daylight. Vaccines from the health facilities direct to the post or vaccination posts, maybe to schools where the vaccination programs are going to be taking place. Immediately they are done, they are supposed to be taken back, because first of all, these vaccines cannot be kept anywhere at home or maybe in people's houses. It is supposed to be under restriction, cold chain, meaning that they should be kept in the fridge. And we cannot allow the health workers actually to move anyhow with these vaccines. There are supervisors that will be moving around to ensure that these vaccinations are going on well and the vaccines are safe, including the vaccine carriers. And it is also the responsibility of the public to notify the city health office in case of anything that is suspicious, which I believe it will not be there. Thank you.
Right, we're at the end of the coming to a close of this discussion, but we're left with 8 minutes. I don't know if there's something that you have not said. You should be able to in this time, so that we give time for the news in Lubarati that is coming up next. Okay, so let me start with the Lucy, and then what is it that you have for the people as far as this campaign is concerned, but also you should be able to assure about the money show during the rubella vaccines program. There were issues to do with payment of VSs. The LC ones are the mobilizers at the grassroots. Many people were promised mobile monies, but things were not coming. So how are we sure that this time things will work out? Yes.
Yeah, thank you very much. The issues of money or concerning payments for the VHTs, maybe health workers, and all other people that are going to be part and partial, there is actually a stipulated budget which is provided by the Ministry of Health through Arua City Health Office. I think for some people who have been able to attend specific meetings towards this integrated child health day preparation were able to actually know the budget, because the city health officer is actually someone very open with the issues of fund. He normally displays the budget, everyone gets to know. So I want to say that the VHTs should relax, and even the health workers, because there is a program that the city health officers prepared in order to ensure that these funds reach the rightful hands, and it will reach.
Okay. So you can exhaust whatever you prepare in the sector.
Thank you very much. Actually, we have basically mentioned most of the things that we had prepared. Only that I just want to remind people out there that the vaccination program is not going to take place only in places that we have mentioned, but any place of gathering, people should expect, and don't be surprised if you see the health teams also moving to places like funeral places where we see children, where we see target groups. We have men also who are supposed to get this vaccination. So any place where people gather, we shall be able to reach. Also in the market, we shall be able to reach.
To the education department, is it that you are
the listeners for having paid attention to what we have been giving them. Why, as education department, I am in for this talk show is to minimize, if not to stop completely, cases of sabotage where government wants to give services to people, and it happens so that some schools do reject this. We don't want to hear such cases. That's why we're in for the mobilization. My dear head teachers, you take note, from 18th to 20th, be ready to avail the learners to the health unity so that they all access the drugs. Cases of sabotage, we are not going to relax as a Department of Education, because when something is a policy, it is a policy. We need all to embrace. So whoever is not going to be compliant, we have our committee which sees issues of such calibers. Then we see how we can deal with them later. So I don't want such cases to happen again. That's why I am here. I expect maximum cooperation in the due course of pursuing this. Thank you so much for God and my country.
Right, that is it from the guests, and my name is Federick Dramadri. We are discussing a lot of issues to do with the integrated child health days. There are so many diseases that government of Uganda wants to kick out of the communities, and where we'll be able to be poverty-free is when we have a population that does not have diseases, that does not have cases of illiteracy, and that's why education is there, that's why health is there, and whatever message you've been able to pick here, you should be able to put it in practice. Talking about preventing other diseases other than all the time waiting for free opportunity from government. Remember, these campaigns, whether they are there or they are not there, there are days that have been apportioned at every health facility to vaccinate these children or to immunize their children against some of these diseases that are always there. Talk about polio, talk about measles, and many others, but you should be able to get your time to move to these health facilities. Even if it is not October, even if it is not April, people should be able to take up those mantles to do those kind of things by themselves. But also looking at some of the issues, the VSTs, you are aware that Rose City Council recently, just 3 days back, on Friday, they approved a supplementary of 29 million Ugandan shillings. And this money is there, it is going to reach you. There's no doubt now to complain around and every time calling the news reporters that please come, things are not working. That is not going to work, okay? Because we are aware that this money is there and we should be able to work really vividly. Because I realized at some point there are some VSTs who do not want to work, but they submit their names earlier. Okay, they submit their names and they make their vice or maybe somebody in the village to work on their behalf, but they don't even help that kind of person in terms of the small monies that are given to them. So we should be able to impress this. The mothers, the parents, general, we should be able to really allow our children to take up this kind of campaigns seriously, to avoid these kinds of children in the long run not really doing well or not being productive to the nation. There are some cultural practices that have been stopped. Talk about one that was cited in Zombo district where a cultural group was saying they don't believe in education and so on. Remember during COVID there were issues about that. We should desist from that if we want to save the nation, because if we are leaving other people behind, those are the same people who will be able to bring us down, will not develop. So we should go together in order to really do this. And churches, church leaders, we should embrace these kind of campaigns. I hope that you have been oriented on what is going on. You should be able to disseminate the same message, and also make sure that when people come for church services, when the health workers are there, give them chance to talk to people, because it will not be good if we leave our people to suffer, yet there are available opportunities for us to recover from those kind of things. I want to appreciate the viewers who are able to comment. Alfred, I appreciate you very much from Awendere, and also I want to also appreciate Dixon from Zombo district. I appreciate you for that, and then many others that I could not now mention because they sent me messages without their names, but all in all I've been able to at least capture some of them. I appreciate you very much. Those who have been watching us and have not commented, I appreciate that you have been with us, and you should be able to send these messages to those who are on 18th. We should be massively moving to some of these gathering places, talk about churches, talk about schools. Children who have not been in school should be taken to health facilities or schools, or there's wherever a place of administering these kind of things, we should be able to take it positively. The one behind the camera is Dijon, and he has been the one who has been focusing on this camera here. The one in the production is Aldo, and I appreciate you people for that good work done. We're out of the studios. Up next, we'll be having the news in Liberty with Fete Emmanuel. Thank you.